Mindy, do you want us to just?
You've gotten lots of, they're asking about diet. You might as well go for it. That was one thing we did not address in this forum, and we will again. It was on last year's, and you're welcome to see that in the virtual exhibit hall from last year. But you have Dr. Beaber and Dr. Singer here. So anything related to what they've just discussed, and we can take a few questions that are off the topic if we have time.
You want us to just pick questions, Mindy, and answer them, or are you going to direct us a little bit?
You can go for it. You can go for it. I see one on diet. So if you want to address that, great.
Well, so what I'm seeing is from Angela White, and she says, outside of a clinical setting, how can you get involved in research? And so obviously the most straightforward way would be to ask your doctor or academic institution where you are. Another good place to find clinical studies is on the National MS Society website. And another way is to go to the website clinicaltrials.gov, and it allows you to put in, multiple sclerosis or other associated features and your zip code, and you can search for trials close to you, and you can actually click, do you want to see a randomized trial for a medication or an observational study, or do you want to see trials already with studied, with things posted? And generally speaking, like the National MS Society is a little bit more user-friendly, it's more simplistic, but if you're more sophisticated and you kind of know what you're looking for, clinicaltrials.gov is probably the place to go.
All right. Thank you so much. I see, have there been studies where a cocktail of MS therapies are given to patients? By cocktail, I mean multiple disease-modifying therapies. Can you explain why or why not? For any of the neurologists or PT, can use of functional electric stimulation, such as bionus, rewire neural pathways, i.e. contribute to neuroplasticity? Dr. Mitzi did address that, but perhaps you have another angle on this?
Yeah, I'll take the combination therapy. So we are starting to see some combination clinical trials. So one of those things that we're looking at is adding things on for myelin repair. So I've been involved in some studies that way, where we keep people on their disease modifying therapy that affects the immune system. And then we're adding something on to try to repair the damage that's been done with myelin. So because those drugs would not interact, we haven't done that. We're able to do that and try something for myelin repair. However, generally in MS, we have used only one therapy. And it's interesting, a long time ago, there was a study of interferon and adding tisabrion in the first cases of PML. A couple of cases of PML showed up. And after that, that was the end of combination therapy in MS, which is interesting because our friends or colleagues in rheumatology world frequently throw on 3 immunosuppressive drugs. And they're like, we're just saving cartilage. You guys are saving the brain and the spinal cord. Like, why aren't we more aggressive?
With you, Anita?
Yeah, so anyway, we're definitely looking at combination therapy, but probably from a different angle, from for something neuroprotective, protecting the nervous system, maybe something myelin repair, and something that affects the immune system.
Okay. Regarding BTK inhibitors, if trials are successful, how many years until they become commercially available? Is there a proven link between interferon injections for MS and pulmonary arterial hypertension? Can you please explain? I'd like to know what a reasonable exercise program looks like to start without rebounding badly in spasticity and fatigue. Wow, those are a few different questions there. Can you see it? Dr. Singer, Beaber, can you?
Yeah, there's questions coming up.
Well, I know, so Dr. Singer, you're kind of involved in some of the BTK trials. Do you have any idea about that?
Yep. Yeah, so the BTK inhibitors. So BTK is bruton kinase inhibitor, and it's basically a when you use this medication, the medications that are out there, there's actually a number of them in clinical trials. And so what the idea with these is they affect the B cells. It's oral medications that affect the B cells. Many of these get into the brain and spinal cord in pretty high concentrations, fortunately. And the idea is to affect the B cells and also a cell called microglia. And microglia play a role in progressive disease, we think, in causing smoldering inflammation. So it would target both the B cells and the microglia. There's a number of different clinical trials going on a few different agents. If you're actually, my last podcast on MS Living Well podcast is about clinical trials, and we talk about all these agents, including BTK inhibitors. So you may want to check that one out.
So to answer the second part of the question about exercise, everyone is a little bit different. I have patients who have relatively mild multiple sclerosis, and they can tolerate very intense exercise with no problems. For instance, one of my patients was actually a college football player. I wouldn't recommend that, by the way, in general, playing football, but it depends. There are people with MS that run competitively and do all sorts of things. For people with MS that have a lot of motor fatigue that Dr. Singer was talking about earlier, it's often helpful to exercise in the cool and to take rests, to do brief periods of exercise, 15 to 30 minutes, and then take adequate rest. It's just not practical to exercise very intensely and then to burn yourself out for the rest of the day. I actually interviewed someone, a David Lyons, who has MS, and he's a bodybuilder, and he talks about fitness in MS. And what he recommends to people is sort of short interval training with weight training. So you're kind of getting a combination of resistance training and cardio, and then to take rest and just to kind of limit it to brief periods of times. But different things work for different people. If you go too hard and you're burning yourself out, just do a little bit less next time.
Thank you. What is the suggested amount levels for vitamin supplements? Either of you want to address that?
Well, generally, the only supplement I regularly encourage people to use is vitamin D. Almost everyone's too low. I don't think I found one person that had good vitamin D levels, but they had a tanning booth at home, which can lead to other problems like skin cancer. So, maybe different for Dr. Beaver in Southern California, but up here at, in the Midwest, low vitamin Ds for most people. So generally, I actually check a blood level to give guidance. I'd say most of my patients need somewhere between 4,000 and 5,000 international units of vitamin D3 daily to get their level where we need it. But some people only require 1,000 or 2,000, and some people 7 or 8. So generally, I try to figure that out. And there was a trial looking over 5 years, and people with low vitamin D ended up with more MRI activity, more relapses, and actually more disability. There are many other supplements that people have encouraged, but we don't have a lot of data to prove that one way or the other they work. Lipoic acid is kind of an interesting supplement that's now being studied in progressive MS, so that may have some benefit. But it's right now we don't have a lot of data to kind of support it one way or the other.
Yeah, unfortunately, low vitamin D is definitely common in Southern California too. There's no strict cutoff in terms of levels. If you're in the United States, the units that are usually used are nanograms per milliliter, and usually labs will report 30 to 100 as being normal. It turns out when people have done studies on like Australian Aborigines or people who are sort of out in the sun all day, they found that people often have levels closer to 100. So it's difficult to say what normal is, but usually I want people to have a level of 50 nanograms per milliliter or more. And just keep in mind that if you're international, the units are nanomoles per liter, and so there's a conversion which is 5 to 2. And so I would use a cutoff of 150 nanomoles per liter or higher. And taking vitamin D, like 5,000 international units of vitamin D3 a day, if you don't have a history of kidney stones or any other calcium-related problem, it's extraordinarily low risk. You can easily get 10,000 international units of vitamin D if you go out in the sun and take your shirt off for relatively brief periods of time. So this is an extraordinarily safe supplement. There's some epidemiologic evidence and like cross-sectional data that omega-3 supplements may be beneficial. There's actually evidence both for fish oil and flaxseed oil. The evidence isn't that strong, but I do recommend that also. Another way to do it is to just put flaxseed in your oatmeal in the morning. That's kind of a more natural way to do it. But otherwise, there's no supplement that's really proven in MS.
Can either of you address the diet? Because that's always a big question. I just saw a presentation at CMSC. Would you like to talk a little bit about diet for MS?
Sure. So I have a lot of interest in nutrition and MS. Now, there's not a single proven diet in MS, but we have a lot of reason to believe that diet and lifestyle plays an important role, simply because the rate of MS is dramatically different in different regions in the world. For instance, in Cuenca, Ecuador, the risk of MS is only 1 in 25,000 versus 1 in 222 in Syracuse, New York. There can be other factors, sunlight exposure, diagnosis of MS, availability of MRI scans, but there's a lot of evidence that the development of our society and westernization of our society is sort of linked to the rate of MS. From an epidemiologic standpoint, in regions of the world that have more higher saturated fat consumption and higher dairy consumption, there are higher rates of MS. So it may be better to have more of a plant-based diet, to eat a lot of whole fruits and vegetables. There's also some association between salt consumption of MS. Any sort of processed food is very high in sodium. Now, I personally, from a practical perspective, think it's helpful to give my patients specific advice. And, I tend to give my patients advice in the book Overcoming Multiple Sclerosis, which essentially advises a whole foods, plant-based diet plus seafood. There's some evidence that fish consumption may be good for MS. That being said, there's really no single proven diet. Someone asked about the Terry Wahls diet, which is more of a paleo diet. And I give Dr. Wahls a lot of credit because, it's not just her own experiences. She's really attempted to study, her diet in MS. She recently published a randomized controlled trial comparing her diet versus the Swank diet, which is a low saturated fat diet. And people on her diet did a little bit better in terms of fatigue and subjective quality of life. It wasn't definitive, in my opinion, but I think any diet where you're eating a lot of whole fruits and vegetables, low in processed foods, is likely to benefit you. You're likely to have better energy, maybe better cognitive function. Does it change the prognosis in the long term? It's hard to say, but it definitely can't hurt. And in my opinion, it could make a difference. Dr. Wahls in our interview said something very pragmatic where she said, in the long run, compliance is probably more important than the specific diet plan. So if there's a healthy diet you think works with your lifestyle that you can actually follow and sustain, that's probably the way to go. If you're going to do something for 3 months and then fall back on your old habits, it's probably not going to help you. Someone posted, but I prefer cake. I definitely understand that, especially during the stress of the pandemic. But I do think diet makes a difference.
Thank you so much. Would you like to address, is it best to avoid vitamin C since it amps up our immunity?
I don't think we don't really have good evidence for that. So I think at this point, just having normal, adequate vitamin C, but I don't think we have any evidence that vitamin C is negative or positive with MS. So I have never seen any good evidence for that.
Okay. Can you explain how doing exercise releases the happy hormones?
Well, one of the things exercise does is it definitely increases our endorphins, which are definitely have a positive impact on our brain. So getting endorphins going makes a huge difference. And so I think that's probably the one of the major physiologic changes. We do know that also exercise reduces, as I mentioned, the fatigue level. So by having more energy, more sustained positivity and more energy, you're going to have significantly less fatigue. You're going to feel better. And it kind of is reinforcing. So many of my patients who start exercising do report that they're not only less fatigued, but they also have a better outlook.
Thank you. Related to COVID precautions, should those with MS be taking additional precautions or do common recommendations suffice?
Yeah, I mean, I can jump on that and then we'll see what Dr. Beaber thinks, but that's a huge issue. And I think, yes, I'm still recommending to my patients to take precautions. I mean, unless you're on like one of the old injectable medications, perhaps Albagio, maybe not, you don't have to be quite as concerned, but many of our MS medications suppress the immune system. So I think we still have to be careful. We're not out of the woods yet. And so you do have to take some precautions. And it's about having that comfort zone of what you're doing. I mean, I don't think necessarily you have to be locked up in the room and not come out for the next year or two, because it's not great psychologically. But I think it is important that you have to be careful. When you go out in public, wear a mask, make sure you're around just vaccinated people. If there's unvaccinated people this holiday season, that's a concern. If you're around them, families. So I think definitely taking precautions is going to be important as we go forward. I don't know about you all, but like if I'm out in public, I go to a restaurant, I wear a mask on, I sit at the table, then I might take it off. So I'm still taking precautions, and I think that's really critical.
Yeah, I mean, I agree in general. I don't think people should be too extreme. You know, I've had some patients who they have had a lot of anxiety over it, understandably, and they're wiping down their groceries. You know, I wouldn't recommend that kind of thing. You know, this is a respiratory virus. You get it from breathing close to other people who have the virus, whether they have symptoms or not. You know, I have 3 patients who are vaccinated, fully vaccinated, and did get hospitalized with COVID-19. So it does happen. It's rare. You know, I have a lot of patients taking a lot of immunosuppressants. All 3 of those individuals were taking B cell depleters, and they all did recover, although one of the 3 was quite seriously ill. You know, prior to vaccination, I've had quite a few patients with bad outcomes, and it was certainly a nightmare in January. I do think there's going to be a rise in COVID-19 over the winter. I don't think it's going to be as bad as what we saw before. You know, my advice is if you're vaccinated, just try to follow public health recommendations, be practical, enjoy life. I would give a little bit different advice to someone who's young and healthy and not taking a high risk immunosuppressant, and someone who's older with other medical comorbidities. So you kind of have to judge what your own risk tolerance is. But it's definitely still out there. And even now, you know, I can see all the numbers that all of our hospitals in Kaiser in Southern California, and there are a significant number of people hospitalized, most of them unvaccinated. So the number one piece of advice is if you've had vaccine hesitancy, definitely get the vaccine. I can guarantee you the benefit far outweighs the risk. No question about that.
Yeah, I think the other thing that just to keep in mind, and I've had about 16 people get COVID after fully vaccinated, but only 1 person hospitalized. One of the things our patients have been doing calling. So if you do get COVID, we can now infuse you with antibody therapies to help you get over it. And a lot of my patients turn around in 48 hours. And now we may have new oral medications. There's a couple of orals that may help get you over it faster. So it is important, like if you do develop symptoms, important to get tested quickly and then contact your MS doc, because we may be able to do something about that.
Yeah, that's a very good point. I think there's this thing with COVID where often, even if it ends up being severe, the early symptoms are usually mild. You know, a lot of people, even if they end up hospitalized, it starts with a cold and it evolves over several days. And the thing about COVID is there's sort of a viral replication phase. And then later, there's sort of less viral activity, but more inflammation in people with severe pneumonia who develop acute respiratory distress syndrome. And so the time for intervention is actually at the beginning in people who have minimal symptoms. And of course, we're not recommending like monoclonal antibodies to everyone. If you're 18 years old, have no medical conditions, eat broccoli, you know, if you have mild symptoms of COVID, just stay home and rest. A lot of people with MS, let's say you're 30 and healthy, but you take Gilenya or you take Ocrevus, you know, that is a risk factor for severe COVID-19, even if it's early. So just ask your medical provider if you would be a good candidate for any of the therapies, such as monoclonal antibodies and possibly in the future, ritonavir or molnupiravir, because that's sort of the time to intervene, even if you feel well and have mild symptoms. And one thing I have a lot of reservation about is that even though these studies look really good, in the real world, people tend not to get diagnosed right away, and so they may be much less effective. So don't be one of those people who waits. If you have symptoms of the COVID, get tested, and if you test positive, at least ask about these therapies. They may say you don't need it, you're not taking any immunosuppressant, you don't have any high-risk conditions, you're young, but at least ask about it.
There was a question along this line, do you recommend the booster for COVID?
Yeah. Well, I had 3 patients who got, you know, I had many patients who got COVID despite being vaccinated, 3 of them who were hospitalized, but none who received the booster. So there's really strong evidence that immunity does wane over time, unfortunately. I myself received the booster just because I'm a healthcare provider. So I would definitely recommend the booster.
Thank you. We're just going to take 2 more questions because we are over our time and we want to be mindful of our speakers' time on this Saturday afternoon. What are the long-term risks of developing cancer years after having had an immunosuppressive therapy to treat MS?
Excellent question. So at this point, we have actually no evidence that any of our medications long-term. There was one that was on that we don't really use anymore, was called novantrone or mitoxantrone. And so that had a small risk of leukemia. But most of our MS medications, we don't really have evidence of long-term. The longer you're on them, the higher the risk of cancer. Unfortunately, we've been following patients over time. With one of the B-cell depleters, Ocrevus, there was initially concerns about, there was the difference in terms of the number of breast cancers on drug versus placebo or Rebif in the clinical trials, the 2-year trials. But as we follow those patients long-term, we're seeing relatively those numbers have come way down. Same thing with some other medications, for example, Mavenclad. There was some concern in the shorter part of the clinical trial, but over the extension, we're seeing those numbers come relatively down. So many of our medications, we're not seeing an increase over time, but there are some of our medications, including the S1P medications, such as Gilenya has some risk of skin cancer, and Lemtrada has a potential risk in their prescribing information of cancer as well. So some of our medications have that listed in there, but over time, we're not seeing an uptake on these disease-modifying therapies in terms of cancer, which is very reassuring for long-term treatment.
Thank you. Last question, and I promise we will answer the questions that you don't have. We will go back to our speakers and put these answers in the virtual exhibit hall.
I guess we're going to be doing this for a while then. A lot of questions.
No. Last question, and then we will close. Do you have any tips for a spasmodic bladder? I've been using breathing techniques and exercise. I am in need of more help.
You want to take it, Dr. Beaver?
Sure. So, there are a lot of different bladder symptoms, so it's a little bit hard to know what the person is asking. Some people could be referring to like urinary hesitancy, where it's really hard to empty the bladder. So one thing is that can sometimes be a side effect of certain medications that have what's known as an anticholinergic side effect, including some of the medications that are used to treat like urinary frequency, such as Detrol. So the first thing is just to make sure you're not taking any of those medications. And then the other thing would be medications that are not for multiple sclerosis or urinary symptoms that can cause the same side effects, such as medications such as Benadryl. For people who have like painful bladder spasms, I think one thing that can be really effective is bladder Botox, which can be done by certain urologists. Probably for people with really bad, painful bladder spasms, that's the thing that I've had the most success with.
Okay, we see lots and lots of questions. I promise we will go through these questions. And I want to express so much gratitude to both of you for being here on your Saturday afternoon, for giving such meaningful presentations, both medically and what we could consider complementary and alternative therapies, and how would you word it, with the spirituality? To me, it is. It's just parts of daily living and how people can empower themselves through the different suggestions that you've made. I love the idea of a gratitude journal, and we could fill that all day long or all night long. I might not go to sleep. It's a great thing to, before you go to bed, to think of 3 things you're grateful for. And when you wake up, and I know tonight I'm going to be thanking all of you and sending you much positive energy. You heal in so many different ways. Thank you so much to our speakers. And I want to thank our sponsors again and our planning committee. I do want to mention that for one of our committee members, she lost her husband suddenly. A terrible, tragic loss. So we want to send healing prayers to Lindsay Dems and her family and her boys. Lindsay is instrumental. She is an MS warrior. She does so much for the MS community, and so did her husband. Namaste, sending you much healing thoughts and prayers. Thank you to Lori Branch, who's been behind the scenes managing our tech throughout the day with all kinds of things going on behind the scenes. Thank you to Marnie Sharon, Kathy McRae in the command center, Leah Narens, Beth Stone, Lori Svensson, and Anita Lamore. She made these amazing purple hats. Thank you so much. Namaste to our gold sponsors, Biogen and Genentech, and to all of our sponsors, including Bristol Myers Squibb, Alexion, Meyer Specialty Pharmacy, Novartis, Sanofi Genzyme, TG Therapeutics, EMD Sereno, and Sun Communities. And a special thank you to MS Views and News for helping us spread the word and have so many of you wonderful attendees. Thank you so much. Namaste. Much, much, much gratitude to you.